Okay.
Ultrasound of a study of a patient aged 15 years. It did not, she has did not have a menstrual cycle so far, and she has been referred to rule out any pelvic pathology. Now what we are seeing is that if you concentrate over this part of the ultrasound, this one, now this is vagina. Let me focus it better. Just a minute. So this is vagina. This linear structure is vagina. This is the cervix. It's small. Measures only 12.5 millimeter into 8 millimeter, and okay, I do not have the impression of any other cervix or vagina. Now this is the transfer section through the same cervix. This is again, now this is again another one. This is the cervix, this is the vagina, cervix, vagina. That was the first one that I showed you. That is a bit, when I angle the probe posteriorly, please focus on this area. This is the vagina and the cervix number one. This is the cervix. This one is cervix. This is the vagina. Cervix, vagina. Now, as I angle the probe towards the left shoulder or towards the left side, here I get another view of I'm telling you that I do not have any gynecological or any female or a lady doctor's findings regarding whether she has two vaginas or now this is another cervix and this is another vagina. So there are two cervices, and this is the left-sided, and now when I move the book toward the right, this is the right side. This is the right-sided cervix, the vagina. This is the one, this is the other. Now, in transfer section again, we do see two cervices. There you see there are one and the second one. Now where is the uterus main body? You see, this is the uterus on the left side. Now this is the uterus on the left side. Body of the uterus, this is the endometrial canal. Now this is the cervix again, and this is the vagina. It measures the left side, it measures 3.9 into uterus. This area is the endometrial canal. He is in Menarche so far. This is the endometrial canal, this one. The cervix, vagina. This is the vagina, the cervix. So the uterus is small in size. This is the urinary bladder. Understandably, it had to be small. 3.9 centimeter by 1.9 centimeter. This is the left-sided uterus. This is the cervix. This is the vagina. Now let's move towards this is the one, and this is the transverse section of the left-sided uterus. This is the transverse section of the left-sided uterus that measures 2.4 centimeters, and this is the endometrial canal. This one, endometrial canal measures 7.6 millimeters on the left side. Now remember, this is the left-sided. This is the left side uterus in transverse section with endometrial canal in the center is there. Where is the other one? Here, this you will see another right side uterus. Here it is. Now on the right, when I move the probe toward the right side, you see this uterus on the right side. Okay, just a minute to show you. Okay, now this is the uterus, second uterus, uterus number 2, that is visualized up to this, visualized up to 2.3 into 1.7 centimeters. This area, this one, this is obstructing the view of the uterus below, and this is the vagina. So this is in fact this is collection of blood or hematometra. This is the transverse section of the right. Let me show you both together. Here. Now you are seeing both together. This is the on the left side, this is on the right side, this is the endometrial canal, this is the endometrial canal. Now there is a cystic area with a few septa and internal echoes. This one, and this is obstructing our view below on the right side. This is not relating to the left, but it is relating to the right-sided uterus, and is suggestive of hematometra. And you see it, this portion takes blood, this area, this is bleed, and it takes blood. Now I'm going to give a sweep to the uterus from longitudinal to transverse. Now you see the both bodies of the uterus are being separated by this pocket, fluid pocket, measuring approximately 2.7 into 3.0 centimeters. Now this is the uterine body number one on the right side, and this is the uterus on the left side, or the second part of it. This is the endometrial canal. On the second part, on the right side, and this is the endometrial canal on the left side. So this is these bodies are being separated by this cystic area filled with internal echoes. Here. Now this is the right side, is this one, cervix, and the vagina, this one, and it communicates with the cystic area, fluid filled with the echoes, islands of echoes interspread throughout, and then it communicates with the rest of the right-sided uterus. This is the right-sided uterus. Now this is the ovary. This, you see the follicular development, 1, 2, 3, 4, 5. This is the right ovary. This one. And so this is in fact a case of uterus DIDEDPHYS, 2 uteri bodies, 2 cervixes, 2 vaginas, with the hematometra on the right side. This one. This is the hematometra, or collection of blood in the body of the right-sided uterus. This is the one on the right side, and because there is no obstruction in between, so we can see it in whole length. You see from here to here, and on the left side here, it is obstructed by a complicated cystic structure which is bleed, right-sided, and we cannot get it through to the it is separated from the cervix and the vagina. As you see, this is the vagina, and this is the uterine body that we measured and seen, and this is all bleed in the body of the right-sided uterus. This is a case of uterus DIDEDPHYS. Thank you very much.